Welcome to episode number 7 of The Great Blue Shark. I'm your host, Chris Hopfer, and today joining me is Emily Eitzen, Director of Human Resources and Community Relation at Fairview Regional Medical Center. Quick story about how Emily and I met. I've been working with Fairview Regional for some time. Prior HR administrator handed over the reins to Emily and started working with Emily. We started exploring some other plan alternatives, and it's just been a pleasure to work with Emily Eitzen up at Fairview. So, Emily, welcome.
Hi.
And how are you today?
I'm good. I kind of the afternoon slumps, but we're making it. Enjoying some rain.
All right. You did get some rain up there in Fairview today. I looked on the radar.
Finally.
Kind of tell me a little bit, describe, if you will, some of the roles and responsibilities that you have at Fairview Regional Medical Center.
So when I stepped in, I was told you have many hats, and it will just be a matter of time before you figure out which each of those hats are. The main one being human resources, so I do most of the legwork with that. I guess all the legwork with that. I also do the marketing for our facility, so all of our social media accounts, our internet website. I do have a little bit of help with the website. IT steps in with me, just because they're a little more tech savvy on that side. And then I also do kind of the community relations stuff. So anytime we've got to be out in the public, I'm usually there when able, things like that. And then I also do our compliance as well. So, and then just kind of any other job that's thrown at me, I guess.
Okay, well, good. Well, that you do the job well. What made you decide to, or steered you in the direction of human resources as a career?
I don't know if I was more so steered to say like, hey, I'm going to college, I'm going to be in human resources. Like, that was not my goal. I knew I wanted healthcare of some sort. What it looked like, I was not sure of yet. I didn't know, I had no vision of what that would be. At the time that this position came over, I was actually on maternity leave. My current job, though, I worked at a pharmacy. I got my undergraduate in healthcare administration, and I had done a clinical, per se, more like an internship here at Fairview. I grew up here. I thought, I want to go see what Roger does. He'd be a great mentor. I'm going to go look into it. And so I did. I really enjoyed it. I thought more of the administrator role, and then this position opened, and I thought, well, I guess that's my step in the door. I felt like maybe that's where I'm called to go for now. At first I was thinking, I get to be the bad guy. I get to be mean. Everyone's going to hate me. This is going to be fun. And here we are 4 years later, still making people mad. Just kidding. I don't make people mad, but not every day.
Gotcha. Well, you've been on both sides of the coin. In your experience, you've got the giving mentality. HR always, in my experience, they want to give to employees. They want to help them. They want to make sure that they're getting the most out of their job, getting the most out of their benefits, etc. In your experience, and under your hat, what personality traits make a good hire in the medical space?
So we may be different than maybe some of the big facilities. Like, obviously we're all going to have the same educational requirements, right? We're going to look and make sure you're licensed, blah, 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 etc. When it comes to rural health, though, it's kind of a different field. We kind of look, one, we need a team player, because for us in our facility, we're very family centered. We care about if your kids are playing sports, if you've got to be gone for something. So we need a full team player that if, hey, so-and-so needs off because their kid's game starts at 3 o'clock and they work till 7, can you be here? Can you fill in that need? And for you to say yes, because we know you may need that someday or may turn it around. So we definitely we want a strong work ethic. These days it's kind of hard to come across people that want to work, especially any additional hours. In rural health, you wear lots of hats, as we kind of discussed a little. And it kind of works not just for my position, but several positions. So we have several departments that intermingle. They work together, kind of do those things that you look for a little bit more. Not saying that other facilities aren't looking for a strong work ethic, but we need someone who wants to show up, they're going to be here, and they've got some loyalty behind them.
Kind of a team player,
Yep.
more so than the corporate, because the corporate, I think, may have just kind of a defined job description.
Correct.
And you do what's in those lines, and everything outside those lines you don't worry about. Versus what you're saying is, hey, this is your job description, but we may be called on to do this. And I mean, everybody's going to be pulling the weight because it's a team.
Yeah, that's kind of like with our job descriptions. They all say, you can find at the very bottom, and I can almost guarantee all of them say the same thing, mainly because I've put that in there, and other duties as assigned.
You're right.
Those
There you
little
go.
fine
Okay.
words that no one really likes because they never know
Yeah.
what it means. But most people are okay with it. I mean, we're not going to ask you to give up an extra 40 hours a week or something crazy. But as long as you have the drive and the will to learn, then we're going to get along great.
Okay. All right. So this is the next question is, in your experience, what personality traits make a bad hire in the medical space, and have you had any of those?
Whew, I think we've all had our fair share of, I don't want to say bad apples, but I mean, no profession's perfect, right? Everyone's going to
Yeah.
have that one that's going to give the field a bad image. We're no different.
Yeah.
That's the way
Yeah.
it is in the profession. Kind of a controversial answer with today's push, it feels like, especially with social media, is we don't like to see more so a job hop. And I know that's not a personality trait. However,
Yeah.
it shows me a personality trait. It shows me you lack a little bit of commitment and you lack some loyalty.
Yeah.
And there's such a push nowadays of, oh, if they're not going to give you another dollar, then go somewhere else that will. Or if they're not going to respect that you leave right at 3 p.m. every day, then you jump to a different job. Because if you look at the big picture of things, like for us, we're a small facility. We can't compete with corporate rates. That's simple.
Right.
But if you look at the full facility and you care about rural health as a full facility, then you're going to notice those people that are going to stay and be loyal, which we've had great success with that. We've got the tenure of 40-year employees and 41 and employees that want to stay here to build with it. So if you hop around, that's usually a huge turnoff for us, unless you have a reasonable excuse. We're not asking you to stay in an unsafe environment or
Sure.
be paid minimum
Yeah.
wage when you've been there for 20 years or whatever. We understand those things. But when you have a new job every 4 or 5 months, it kind of makes us wonder, are you not a team player? Are you not loyal? Grass
Yeah.
isn't always greener, is kind of what we tell people.
Yeah.
If we have an employee come to us, well, they're offering $20 more. Okay, then why can't they keep employees?
Right. Exactly.
I mean, it's not always...
And so, when you're trying to hire a new candidate now, you got multiple positions, so this is probably a moving target here. What do you see the current employees focused on as a priority, in terms of benefits? What are they looking for today versus what were they looking for just 4 years ago? What do employees want to have as bargaining chips?
I think right now huge is health insurance. It's
Okay.
expensive, especially when you don't have a company that's going to pay a portion of it. Especially in a small town, a lot of these mom and pop shops can't afford to even provide that for their employers. So they're looking for the benefits of how is my family going to be covered. I know a lot of people are looking at that. And then another huge thing, which has increased since I've been here, which is interesting, is actually paid time off. It's been a deal breaker for people. I'm not getting my 6
Really?
weeks off immediately, and it's kind of like, so why do you want a job? I'm confused. Hold on. So we've lost
Yeah.
a few on that. From in the beginning, though,
They wanted 6 weeks of paid time off, paid immediately.
sometimes, yeah, it was like, well, I deserve to have this much time off because I have this, this, and this. It's like, well, it kind of doesn't work that way.
Yeah.
So it's a hard one to explain to people. The entitlement of it has changed a lot. And I think social media and internet and all of that has perceived it in such a way, which is the downfall for employers of, well, if they're not going to give you what you want, someone else will. So just ask for
Yeah.
it. So it's been such a
Yeah.
bargain, which I'm not against bargaining for what you deserve and what's rightfully yours, but you've got to be okay with if the answer's no as well.
Yeah. And that's, I mean, hey, that stands to reason for sure. What does that look like today versus 4 years ago? What's been one of the biggest things that's changed in the employees' demands, or perfect wish list versus what's reality?
4 years ago, people still cared about what their health coverage looked like. It seemed in our area, though, they weren't as concerned because a lot of people were married into the oil field. They had a significant number of oil field, and they got good benefits. Things like that were a huge one for them. I think a lot has transitioned on advancement. So some people want to know what advancements they can get in roles, I guess, not like money advancements, but roles of where am I going to go? What's my next step? Are you just going to hire me and I'm always going to be this, or where can we go with this? So, which are great.
So education and advancement, that's good. Well, you almost want an employee that's looking to do that anyway. They don't want to just start and be there. They want to you want to grow into the company. What's my opportunities beyond where my entry's at?
Exactly.
Okay. Being in the business that you're in, I mean, I know that you can probably give some of the smaller employers out there a little bit of some key tokens, just based on what you've learned in your career and have implemented into some small business help from a recruiting standpoint. What are some of the things, if you had you was leading a local chapter of the Chamber of Commerce up there in Fairview, what would you say, hey, this is what we're seeing employees value a lot, and if you're looking to recruit and hire and retain some people, here's probably the top two things that you may look at adding in your portfolio to recruit. What would those be?
For us, that we've learned, especially in the past year or so, probably the past 2 years, is employee buy-in. So when it's just as important to know your employees' goals and dreams as it is to focus on your businesses, because without those employees, you have no business, right? I mean, they're your backbone.
Right.
They support you. If your mission and values don't line up, then no one's going to be successful in it, right? So for us, giving that education, because a lot of ours, they just want to be educated. They want to know more about different things. Like, we can post a job internally and they're going to say, well, I don't have those skills because I was never taught those skills. So if you invest in them, they're going to invest back in you, and that's a huge deal. One of our other things that has worked best for us is grow your own. I know that's hard for some industries. Even for us, it's hard. But if you think outside the box with it, and you can partner with tech centers and high schools, things like that, you can bring someone in and grow your own. That's kind of what we've done. We've sent CNAs to LPN school, and they've come back. Now there are LPNs, so we've taken an entry level to a different level. We have a high school student that comes in and does different things for us for IT intern. I think that's a huge part of growing small businesses.
All right. So when I left for internet difficulties, I understand that Emily nailed that question, and that's awesome. Thank you, Emily. What I recall was that you want to have team players, number one. You want to know what their goals are so you can help them accomplish everything that they want in the career. And then you blend in, how do we help them get what they want in forms of, education, advancement, and development. And then if we help our employees to win, we as an organization wins. Is that what I'm hearing?
Yep, that's correct.
Perfect.
Exactly.
Perfect. Anything else that you want to add to what we've went over?
I don't think so. I think we kind of covered everything.
Okay, perfect.
A good amount.
Hey, where can people find out more about Fairview Regional Medical Center and find out more about you?
We are on both Facebook and Instagram at Fairview Regional Medical Center. And then we also have a website, fairviewregionalmedicalcenter.com. We're in the process of getting it updated right now. So if you see some things that are a little outdated, that's why. And then me personally, that's a good question. I'm on LinkedIn if you want to find me on there. I'm going to admit I'm very bad about checking my messages on there because I get hit up by tons of recruiters.
Yep.
But you can find me on there.
Good. And is there anything that the hospital, what's the next big initiative for Fairview? I mean, you guys got a job fair coming up, hiring, a lot of new positions, or is it kind of just status quo for a little bit?
Right now we are in the, I don't want to say beginning stages because we've kind of passed that, but we are still in the early stages of getting our Parkinson's program rolled out with our therapy group. So that'll be huge for Northwest Oklahoma as we don't have anything like that. Our therapy department has done a great job in finding new things and informing us of what they would like to educate on. As far as everything else, we're kind of like most other businesses, we've still got nursing shortage. So if anyone wants to come be a nurse in rural Oklahoma, we definitely will take you.
All right. Emily, hey, thanks for joining me today, and thanks everyone for tuning in. If you got any questions that you'd like answered by the Great Blue Shark, feel free to reach out to me on LinkedIn, and I'll have the link in the description. If you like the episode, obviously don't forget to subscribe, follow, give us a 5-star review on Apple Podcasts and Spotify to help us to get more Great Blue Sharks to come share their story and advice. So with that, Emily, thank you for your patience on getting the podcast started, the technical difficulties and everything. So I enjoyed it, and I hope you did too. Thanks again.
Thank you, Chris.
Bye-bye.
Bye.